So we've had a lot of we in this presentation without actually saying who we is, or we are. So we are all 31 health and care organisations in northwest London, which means we have more logos than go on the top of the slides for this afternoon's presentations. And the other we who we are is an awful lot of lay people. So Professor Pace, who's in the audience, has been marshalling a large group of lay partners in all the different work streams. And you've been hearing about just one of the work streams, all about population segmentation. We've also spent the last few months looking at care models, information flows, payment mechanisms, provider governance, and commissioning governance. And we've almost finished pulling all this together, and we're about to have a book called A Toolkit of How to Do Integrated Care in Northwest London, which is going to be used by everyone who is going to be putting this into practice. The idea is that we're going to be doing lots of shadow integrated care pilots across Northwest London in 14-15, and it's all going to go live with real capitated budgets in 15-16 is the plan. To get there, we asked just before Christmas for all of Northwest London, are there providers interested in experimenting with integrated care? We received 25 expressions of interest covering the whole of the geography and with every provider being part of it. We're now in the process of refining the expressions of interest down to a manageable number of pilots to launch in the next financial year. The key criteria in the pilots are listed on the slide. And the most important things about it are the CCG and local authority have to work together to have a pooled budget to give to the capitation, to give to the localities. We're working with NHS England about whether we can include primary care budgets into that. And then care has to be organised with around the GPs. It is quite a massive undertaking getting everyone in the right place to be able to do this, but the enthusiasm in Northwest London is massive. One of the big sources of enthusiasm is Craig Tanio, who I'm going to introduce you now, who he's going to tell you all about Chen Med, his organisation, and not wishing to build him up too much, but the last time he came to speak, we had all the CCG chairs around a table, and Craig was in Florida on a teleconference, and it's the first time I've ever seen GPs get out a book to write down the answers to all their questions. So, so without further ado, Craig, tell us all about Chen Med.
Thanks, Daniel.